this partnership, what does it entail? And why was it even considered? And is COVID a big part of the planning?
So maybe I'll start a little bit at a higher level, just to kind of chat about some of the things that have been going on. And I think we've been hearing in the news regularly about the impact on multiple sectors. I think in Huron and Perth, we've been lucky enough to have some wonderful people that we've been working with all along. And as the volume of work and as our needs to respond to various crises have evolved, it's been increasingly important for everyone to build their ability to work to full scope of practice. We need sort of all hands on deck doing as much as they can to respond to needs. As we've identified these needs that have arisen, you've also heard that there are populations that are particularly challenged, have been isolated because of their time at home, and that has added impact on their mental health. There has been a need basically to provide some sort of an outreach to get to them. People have talked about the third waves, which is a wave of folks where their traditional health issues have decompensated to the point of needing urgent care. So what we're trying to do is to provide care to some of those people so things do not go awry while we're waiting. You'll be introducing the rest of the team here, but they've done amazing things. So as others have pulled back and transitioned to telemedicine, there is still a clear gap where face-to-face care needs to be delivered and given at point of care. And these folks have stepped up to do this time and time again. So I think that's kind of been the need, is the isolated populations that have particular need, a need to deliver traditional care in a new setting, and a need to expand scope as our drivers for change.
Absolutely wonderful. So let's talk about the history of it. How was it started? How was it brought to the table, and why was it even considered?
I'm happy to answer that. The program actually started in 2012, the Primary Care Nurse Practitioner Program. And the goal of that program was actually to support and provide access to primary care for those vulnerable patients that Dr. Narayan has referenced. And in particular, it was those individuals with mental health and addiction and complex, frail, elderly individuals who didn't have access to a family doctor. So the program has been up and running since then. What COVID-19 brought to light in 2020 was that, as Dr. Narayan said, people became much more isolated. So in 2020, we actually received one-time funding from the Southwest LHIN to specifically target and provide care to those individuals without access to primary care who were further alienated as a result of COVID-19. And we decided that we were going to target the homeless individuals in Huron County. The outcome was very positive. There was a strong working relationship with social services in Perth County, and the number of individuals that were supported really demonstrated that in-person, on-site outreach made a difference in people's lives. So what we did is that with now the COVID continuing in 2020-21, we once again received funding. And that's where we were able to recruit additional nurse practitioners, develop this partnership with our community paramedicine partners in Huron and Perth, and also to bring in a pharmacist.
That's great. Thank you so much. Now, when it comes to the partnership itself, what does it exactly mean for Huron County? I know, or were there any issues that the county was dealing with beforehand that this partnership is helping resolve? What kind of funding are you receiving from the Southwest LHIN, and how is it going to benefit the paramedic response throughout the county?
In Huron County, prior to COVID, we were already having issues with homelessness, elders at risk at home, people in rural Ontario, especially people are at risk in rural Ontario, in some cases more than urban, because they don't have the transportation and access to healthcare that you may see in urban areas. Because of that, the program has really allowed us to get out there and be able to do assessments with these people. Issues with the homeless specifically for the funding that we have right now through HPHA in the Southwest LHIN. We've got a lot of, I'll call them clients, not so much patients, that are really hesitant to seek healthcare because there may be quite a bit of bias with their mental health issues, other things going on. We're able to see them in their environment where they feel the most comfortable, take away that bias that may be there, and treat them as human beings as they are. In Huron County, we have an ever increasing population of homeless, unfortunately. A lot of people that are not just living out on the streets, but for the term that we call couch surfing, people of that nature that we're really trying to be able to touch and be able to get a hold of. We have received a certain amount of funds from through the HPHA to assist with this. And so far what we've done with that is twice a week for 4 hours a day on Tuesdays and Thursdays. We go to the Out of the Cold shelter in Goderich and provide that partnership care with a nurse practitioner to be able to help these individuals within the community.
And of course, I'm sure the pandemic has really seen or has really caused a rise in homelessness. I mean, I've seen it here in the Kitchener-Waterloo area, and I'm sure no other county is exempt from that. When it comes to Perth County, the Stratford Beacon Herald reported that you will be receiving $35,000 in funding. How is this going to help your services, your paramedic services in the Stratford Perth area? And are you expecting to see even more support from this partnership?
So what the funding enabled us to do is to partner up with the NP program and to look at some of the clients that Penny mentioned that are isolated and don't have primary care physicians. So we follow up with some complex patients who have complex medical histories with Dr. Narayan, and we follow up with in-house visits to help support their care and to make sure that their care plan is going according to plan, as opposed to anybody who would be exacerbated in their condition at home while they're isolated and not able to access traditional health care. The other methodology we're using is we're partnering up with the NPs and the pharmacists to reach out into the homeless shelters and the temporary shelters that have been set up and to bring the care to them. So paramedics are uniquely in the response. We're very good at the mobile piece, as Bill was mentioning. And so we also provide advanced diagnostics and history gathering. And we help to inform the client's condition in partnership with the NP and the pharmacist. So the synergy really comes from the sharing of our mindsets, and each caregiver has a different mindset that they bring, and it allows for a really broad clinical picture as well as treatment in place. And so the funding has really allowed us to get out and see people who normally would not be able to access traditional healthcare or even traditional clinics that you set up in a fixed location.
And it's great to hear that really across both Huron and Perth counties that this partnership is really going to help benefit those who are vulnerable to the COVID-19 pandemic, and even when they're suffering from issues that isn't COVID related. Now, of course, COVID-19 itself has made an extreme impact on the homeless and the senior community across both counties. How will this partnership support those communities as well as in long-term care and retirement homes, helping them get back to a somewhat new normal, if you will?
what I'm going to say is just that what community paramedicine and those partnerships have created, specifically in response to COVID, is created a lot stronger partnerships, not only with Huron Perth Healthcare Alliance, the LIN, Huron Perth Public Health. We've all come together to essentially attack this virus as a team instead of being siloed into our own individual, what we would call our normal practices. We've initiated COVID swabbing for at-risk individuals in their home, going out and doing COVID assessments for physicians at the same time. We are partnering with long-term care home, retirement homes, where community paramedics are in there on a regular basis, providing screening and swabbing and actual vaccinations now also. And it's just created an incredible partnership with a bunch of groups that have come together really effectively to be able to help treat these at-risk populations.
And when it comes to the allocation of these funds coming from the Huron Perth Healthcare Alliance, how are you really deciding on where this money goes and where this funding is going? And what are you receiving this funding from the Southwest LIN? And is that how it's breaking down?
What I can say is that when we applied for the funding, we really wanted to target high needs populations, and that's been actually validated through our Huron and Perth and area Ontario health team. So the complex frail elderly and the individuals that are struggling with mental health and addiction needs were the priority populations that we identified, and then subsequently the Ontario health team and all of those partners. So that's how we came about identifying these as being the priority population. The other great thing that this partnership is doing is that, as we've talked about, these are individuals that don't have access to primary care or don't have a family doctor. All of the work that we're doing actually supports the work that needs to go into having a patient being rostered by a family doctor. So the information that we're collecting, the work that's being done, the care that's being provided will actually flow to, with the client's consent, of course, to the new family doctor that will be assuming care. And one of the statistics that we have is that thus far, since the program started, 38 individuals who didn't have access to care, didn't have a family doctor, have been subsequently rostered with a family doctor.
And that's absolutely great to hear. And I know it's an absolute struggle finding a family doctor across anywhere in the province right now. I mean, I currently don't have one myself. Still been looking for 2 years. But it's great to hear that people are finally getting connected with the healthcare advisors and doctors that they need to be connected with. Is there anything else anyone would like to mention or talk about that I didn't mention about this partnership at all?
Just one thing that I would like to add is that the community paramedicine program that both Huron and Perth run is very multifaceted and actually has a few different funding streams. We do get the funding for high intensity from Huron Perth Healthcare Alliance. We also obtain some funding directly from the LIN for high intensity patients also. And the majority of the funding is still coming from the County of Huron itself and Huron County Council, who have decided that this is a very important task to take on to help all of the citizens of Huron County, no matter what position you're in.
And that's great. And that's the more we can get people covered by any kind of healthcare, the better. It's something we really need, especially in these certain times. Is there anything else?
And if I could add something about the COVID situation and how it informed this partnership, I think the one thing that COVID really did for all of us was it really drove us together as healthcare providers to commit to innovative ways to provide care to the community, working together with our system partners to actually really integrate a health response when one agency couldn't go out anymore or somebody couldn't come to them. And it was finding the partners that could still go out and efficiently do that really, COVID really fostered that need and pushed everyone to make sure we joined together. I think the other thing that is really important to think about in here is really the most important thing to all those clients, for everyone who's at home or in a shelter, is that by having someone come to their door, and even to have an integrated team of professionals come to their door and provide treatment and assessment for them when they thought no one was coming. The big benefit is that they know someone still cares. And I think that's one of the pieces that I just want to highlight.
I just wanted to take the opportunity just to say that we are within Huron and Perth collectively 5 days a week, Monday to Friday, helping out, and it wouldn't be without our partners to be able to do that. We have also been able, as Chris said, in Perth County to partner and go mobile and to really go where the individuals are. We've heard from clients, sometimes we ask them, if we weren't here, where would you go? And a significant amount of them have said either they would go to the emergency departments or they wouldn't access care at all. And the stories that we have heard and the impact that we have seen in a short amount of time, in really 40 days, is just, it's humbling. And it keeps us going and keeps motivating us to do this. And as Chris and Bill have said, we're in this together, and it's such a great partnership. Just want to mention that there's 200 people that we have serviced now within this program with our partners. And that's in addition to the 350 clients that the nurse practitioner program has been serving. So that's about 550 people that we have been currently serving within our 2 counties.
Thank you very much for bringing that up and mentioning that. And thank you again to all of you for taking the time to speak with me today to talk about this. I think it's a great initiative that's coming to these 2 counties. It's something that's well needed, and it's going to really benefit Huron and Perth both very well. And I also wanted to thank you all thank you all for really your service during this COVID-19 pandemic. It's you all are really making such an impact throughout these communities to really get through this difficult time for everyone. And I think with this partnership, we're just going to make much further strides to get out of this safe and alive. So thank you.